Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
Well, joining us on the phone today is Jennifer Balducci and Christina Thomas, who are the, I believe, founders and owners of One Physical Therapy, Fitness, and Wellness right here on Bay Ridge Road in Annapolis. How are you guys today?
We're great. Thank you.
Did I get that right? Are you the owners and founders?
Yes.
Were you guys both friends before?
Yeah, yes, we were. We actually worked together for, I guess, about 10 years over at Fitness Forum Physical Therapy.
Oh, where was that?
That is, do you know where the Double T Diner is? That's what I always say.
Mm-hmm.
It's right over there.
Okay, cool. I didn't know. So you guys knew each other before and said, we can build something better.
Something different, I would say. So not necessarily better, just a different animal. So Fitness Forum is a traditional physical therapy clinic, which we loved, and we love doing physical therapy day in and day out. But we definitely saw a need for a lot of our clients that have been with us for a long time over the years. We didn't want to just lose them and have them go off and, re-injure or exacerbate an injury or get a new injury and not being able to help them in a continuum. So we decided along the way that, we wanted to be their people. So in traditional physical therapy, oftentimes you see someone for a course of care and then you discharge them. But we don't want to discharge our people. We want to keep them and we want them to be part of our family for the long term. So having them as part of their wellness journey and having more of a wellness-based practice has allowed us to do that.
Okay, well then you're going to have to educate me here, because when I think of physical therapy, I think of back when my knee was hurt. I met that evil woman that made me cry out in pain left and right. And I also think of sports physical therapy as far as, when a football player gets hit really bad on the field, the PT rolls out on the field and, does whatever they do and the tapes and stuff like that. But what all do you guys do at One Physical Therapy, Fitness, and Wellness? Because you've got two extra words after physical therapy, fitness and wellness. So apparently you do something else.
We actually offer a lot of services. Like Jen mentioned, it's, we wanted to offer something different and, a place where, you could get everything in one facility. So again, hence the name One Physical Therapy, Fitness, and Wellness. So not only do we offer physical therapy, we also offer acupuncture and massage, and we have Pilates. We have exercise classes. We have, Jen, what else am I missing?
So pretty much just the whole continuum. So dry needling, personal, kind of post rehab training is what I like to call it, because we don't necessarily do personal training, but after somebody has gone through traditional physical therapy and they've gotten to a certain point, but then they want to continue on their journey to get stronger, and physical therapy might have cut them off, but they want a safe place to go to continue to exercise, we can provide that service. So, and obviously since COVID, everything has kind of pivoted and switched. So now we're doing a ton of stuff virtual and live stream. So we have a huge amount of live stream classes to offer to pretty much anybody for anything.
Well, that was one thing I was going to, ask is, how badly did COVID send you guys into a little bit of a tailspin? And I don't feel bad about saying that, because it sent everybody into a tailspin. Nobody was in this, but I would think that you guys are very much in the literal and figurative sense, a hands-on business.
Yeah, absolutely. Yep. And I would say, John, that, as soon as everything's shut down, with the physical therapy side of things are essential. So we could continue to see clients in, underneath the umbrella of physical therapy. but obviously all of our other modalities kind of went away. So massage closed down, and acupuncture, really, there wasn't a lot going on there, and people couldn't come in and do Pilates per se, but we were able to, just change how we do things. And we immediately started doing a ton of telehealth and a ton of live stream classes. So that's kind of how we've been able to make it through this whole mess.
Well, telehealth is fairly new to me. I mean, obviously it came into the forefront when everybody was dealing with this. I mean, were you doing any kind of virtual stuff prior to COVID, or was it all face to face?
It was pretty much all face to face.
Yeah.
Yeah.
This has really changed how we do things, and we'll change it forever for sure. So I think going forward, once things loosen up and more people feel comfortable coming back into the studio, we're going to definitely have more of a hybrid model. So even if people do come in for a class, we'll still do a live stream version. So people that can't make it in, whether it's for work or, the weather's bad or the traffic is bad or Forest Drive shuts down for the 8,000th time.
Yeah.
They can still attend a class. They don't have to miss it.
It's funny. I think that you look at any number of businesses, and you obviously just sort of highlighted that, but the restaurant businesses, and I'll pick on your neighbor down below you, the Main and Market, that the takeout, the carry out business was a very small portion of most restaurants' businesses. I mean, you would every now and then you'd get somebody call and say, "Oh yeah, I want to come and pick up a dinner or lunch or something like that," and then maybe there's 10 doggy bags a night that are going home to eat as leftovers. But this is a real thing now, and I mean, they're figuring out how to package them and how to get it there so it gets at home, and the experience at home. It's not the same, but it's close. And I think that you see businesses really adapting to just a different way.
So I'm also president of our business association for Forest Drive. So, I'm super proud of all of our SOFO businesses that have been able to, just change how they do things and to push through and survive. So, they've done an amazing job at, figuring out how do we make things work during this time.
Well, they really have. And I know we've spoken with several of the business owners there. I know we've talked with Jared Libman and talked to Dave Marburger, and we've got a couple more, and you guys are here, Main and Market. And, it's amazing how resilient businesses can be and how much ingenuity comes into play when you sit there and say, okay, well, how are we going to do this? It wasn't a question of what are we going to do? It's like, how are we going to do this?
How are we going to do? Exactly. That sums it up. And I feel like for most small business owners, that's what we're exceptional at, whether it's, having curbside, pickup or delivering wherever people need to get delivery. I mean, really, people have thought outside the box and amazingly well.
Well, I will say that, and I've been a firm believer in Main Street businesses, and that's not necessarily Main Street in Annapolis. It's just not the big corporate entities that we see. And I love the part that I love, and this probably is why I'm on my own and don't do well in committees and boards and stuff like that, is that when things get mired down in bureaucracy, it's crazy. You two own this business. Okay. So I imagine this is over a beer. Hey, we need to do this. Boom, boom, boom. And it's done. I mean, there's going to be some back and forth, of course, but
a little bit more than that, right?
But I mean, things can happen quickly. You can make the decision, okay, we need to do telehealth. Okay, so now you need to buy some technology. How are we going to get the money for this? We don't have it maybe we don't have it in the bank. Maybe we do. Hey, look, there's PPP loans. Can we use that? Let's talk, boom. And it's done. And a lot of that, I'm sure you guys probably learned an awful lot by trial and error as you went. I mean, obviously this is something brand new, and you figure out how you do it and retraining your clients.
Yes. That, right, Jen? I mean, it's this computer technology stuff is we have learned a lot. It's definitely been a learning experience.
Yeah. So John, one thing you might not realize about healthcare providers is that we tend to be the least tech savvy people in the universe. So we're people, and we have gone into the digital world kicking and screaming. So, we really didn't start doing electronic medical records until we opened our business here 7 years ago. So before that, it was all paper charts. So literally, opening a business 7 years ago, we had to figure out how to navigate social media. And then, how to do electronic record keeping. And then when this happened, forget it. Now we had to master video production and sound and, any kind of IT problems that have gone on. So it's definitely been a whirlwind, eye-opening, and a huge, huge challenge for sure for both of us.
And it's so good when you can focus on what you love and just let the other stuff, somebody else worry about it, whether it be a contractor or whether just the system handles itself. But when you have to reinvent, you do need to know. Now, you guys have really grown. You said 7 years that you've been in here, but you guys have really grown. And I've sort of, I want to say casually followed you, but I've seen that you're adding staff and everything else to go on with the different services that you offer. How did you achieve your growth from back in 2014 or 2013 when you guys started?
Yeah, we actually opened December 2013 was when we opened our doors. So for all intents and purposes, 2014.
How have you grown since then? What all have you added? Was it initially just a physical therapy type of a practice?
When we started, we did have, we had somebody that did Pilates, and we had another physical therapist that did dry needling. But also before we opened, Jen and I, it was probably a year that we were getting a year in progress to open. So we were trying to develop a client base as well. So when we opened the doors, it just wouldn't be up, here you go. It was a year of us, working on trying to continue to develop a client base. And as the years have gone on, a lot of, what do you say, Jen? It's a lot of people.
I think we had some relationships, John, with some providers that we had known, just because with physical therapy, we're really good at referring out for things. So, we would say, okay, I want you to go to see this person for yoga. And then we want you to go here for your personal training, and here to get your massage, and here for acupuncture. And so we had some of those relationships. And then, from that, when you have that kind of base, you can grow, because word gets out about how you do things. And if you do things well and you treat people well, and they have a happy, work environment, and they're respected, as being part of our team and our family. So, the beauty about what we do here is that, one person might start seeing someone, and then we say, you really would benefit from this. So we can guide them to other services that we feel they may need, and that might benefit them to kind of continue to push them along their wellness journey.
Did your clients really sort of guide you along that journey? Did you expand based on what your clients were needing, or is this something that you said, hey, this is where we want to be? We want to go physical therapy. We want to go the holistic, wellness and the fitness and massage and acupuncture and everything else? Or is that? Yeah,
I think Christina and I both, working in traditional healthcare for so long, we just were getting to the point where we're getting kind of, I don't want to say frustrated, but for lack of a better word, just, insurance companies more and more were being, telling us how we could do things, how, you can see this client for 3 sessions and then you've got to discharge them. You got to charge this ridiculous copay to have them come in to see you. So we were just finding that was becoming bringing kind of less joy to what we loved. And we wanted to be able to do it under our own terms. So, with the way that we do things now, we're not insurance based. So we are private pay. And through that, we can work with people one-on-one and give them our full attention, not 20 minutes of our time. So it really changes how you practice, and it makes you a much better provider. I
will wholeheartedly agree with that. The first time I realized how imposive, I just made up a new word, insurance companies can be, was when I was talking with a dentist on, and he's retired now, but it was on the bottom of Old Forest Drive in Chinkapin Round Road in that little brick complex right there behind the R.S.T. Allen statue. And I was just saying, hey, where's the old bend over, grab the cup of water, sip and spit thing going on? And why is everything with that hooky thing that goes in your mouth and sucks the spit out? And he said that was all really forced upon us by the insurance companies because they weren't paying us enough. And because now we suck the spit out of your mouth with the gizmo as opposed to having you take the time to lean over and rinse your mouth and spit it out, we can get 5 extra patients in a day.
Right.
And it just dawned on me that this is unbelievable. And I mean, I use Mike Friedman at Evolve Medical Clinics, and he is great. I mean, you sit there, and I remember I was on a bike ride and I ended up pinching a nerve in my back. Didn't realize what it was, and it felt very weird. It was like, am I having a heart attack? Because it wasn't in my back. It was like elsewhere. And, I go in, I'm feeling like Fred Sanford going, oh my God, it's the big one. It's the big, But he spent all the time. I'm like, well, could you throw the he says, okay, we'll do the EKG, but I don't think that's it. That's it,
Right.
And there's something to be said when you can work with a health practitioner or any kind of a wellness practitioner that is more focused on you and the experience and you than what's in the room next door, because I've got to get there in 5 minutes.
Exactly. Yeah.
It makes a difference for sure.
What would be one thing that most people would be surprised about One Physical Therapy?
We have something called deep tissue cold laser. And what that is a really powerful way to reduce inflammation in the body and target the body's own ability to heal itself. So it stimulates your own mitochondria to help make healing work faster. It's been used, for years on racehorses and in veterinary clinics. Traditional insurance companies do not cover it, and that's why you don't see it in a traditional physical therapy clinic. But because we operate under a different model, we can use it, and we've had really great success for an acute injury or an overuse injury, or helping up to speed, stress fracture healing, all those kind of things.
It gets in obviously subdermal, but
So the light, it's a very powerful laser that's absorbed at a cellular level. So it's absorbed by your mitochondria. And when you stimulate your mitochondria with light, it makes them more effective at their job. So they eliminate waste faster. They bring more nutrients and blood flow to the area. They release nitric oxide. And all of those things are the building blocks for healing. So you're just going to stimulate the body to heal itself faster.
That's really cool.
And it's very quick, and I think that's the good thing too, is that somebody can come in and get and it could take between a treatment could be 5 to 8 minutes. I mean, it's not very long. So they're in and then they're, and they're out. So it's a real quick treatment.
Very neat. Hey, here's a question for you. What's the difference between physical therapy and chiropractic? I was looking at, I know you talked about, some of the different adjustments and stuff that you can do in massage. And I know it gets border. I mean, in chiropractor, you've got a doctor of chiropractic medicine, which is it's just a different way of going about treating clients. So chiropractors, they go to chiropractic school, and they're typically teaching them, part of their training is, how to do safe grade 5 manipulations. And then the other part of their training is business school. So learning how to run a business and get clients and how to make it profitable. Physical therapists are really, they can do anything, underneath the physical therapy umbrella. So you can have something, from wound care and pelvic floor therapy to sports, more sports oriented physical therapy to, acute rehab and post-stroke and head injury. So, physical therapy is a wide continuum of care. And there's a lot of knowledge based on how to rehab someone and a lot of psychology, because we spend so much time with our clients. I feel like chiropractors, you're seeing them for maybe a 5-minute session, typically, not all. Okay.
But you're kind of in and out. You're getting your adjustment and then you're out. And then there are other chiropractors that treat completely differently and they use different modalities. But there definitely is a difference, between the two professions.
Well, it's one thing I'll say. I mean, my limited experience with a physical therapist from coming off of an injury is that you guys are very creative and resourceful as far as being able how to figure things out. I know that, I was sent home with, okay, do you have a milk jug? Yeah. Okay. Rig this up and work this on your knee type of a thing, which is amazing to me, because this is, okay, you're problem solvers. I mean, okay, we need to get this joint, we need to get this bone, this muscle, this tendon, whatever it may be working, range of motion and everything else. Let's figure out how best to do it. It may not be coming into, one physical therapy, fitness and wellness once a week. It may be coming in once every other week, but doing this stuff at home, which I think is really kind of neat. What did you do? I mean, you guys kind of build recipes as you go along for everybody's own individual care.
Exactly. Yeah. You sum that up perfectly, John. I think that in a nutshell is what physical therapists are really good at. We definitely think outside the box. We're definitely creative. And we're, always going to come up with some other way to solve a problem.
Now, you guys were working for somebody else prior to going into business for yourself, right?
Yes. Mm-hmm.
So what was the biggest surprise going into business for yourself? And how did you guys remain friends this long?
Okay, let's first answer the first question. So the biggest surprise going into business for ourselves. I don't know. I can't think of any surprises. I love what we do. I mean, it's been definitely stressful, but it's been great. And that I could actually go, drive to work and be happy and excited about coming into the office. And I always feel like, Jen and I make a huge difference in people's lives, for the better. And I guess maybe that would be something that I never realized that we could offer so much and do so much for our clients. I think we do a lot for them, and it makes me happy, for sure. What do you think, Jen? What was the biggest surprise?
I think that what Christina's probably like trying to communicate too is just that, with this business model, the way we've done our, done it from day one when we opened up, is that people are with us for the long haul. So, we can see them throughout their lives. And I think for, in a traditional physical therapy setting, maybe you're seeing someone for 3 weeks or 4 weeks and you may never see them again. But here, we can see somebody throughout their lifetime. So I think that's been the most rewarding and the biggest honor for us, is to be able to do that and to give back to our community that way. And provides, like, we never have to turn anyone away. So, again, when you're working in a traditional healthcare model, you legally have to take copays. You have to take, if someone's got a huge deductible. Here, if somebody doesn't have the means, we can do pro bono work, and that's our choice and our decision. So, you're never going to get denied care if someone needs care. So I think that's been one of the best things about opening our own business, to have that, empowerment to do that. Well,
that's neat. Now, do most of your clients, are they clients or are they patients?
We call,
or they both?
Clients. Yeah. I don't really feel like anybody's a patient. That's more like a sick model. We really have a well model. So you're a client or your family,
Now, are most of your clients there for the duration? I mean, I'm assuming that somebody can come to you for physical therapy for that 3 weeks or 6 weeks to come off of an injury or something like that as well. I mean, provided that they're, with the understanding that you guys are, not an insurance type of a thing and it's a self-pay thing. But are most people that you work with, are they there for a multitude of the services that you offer? And, hey, this is my yoga place. This is my place for Tai Chi. Is that pretty much how it works?
I feel like, yes, there are a lot of our clients are with us for the long haul. And because we offer so many services, if needed, they will do the different services. And then even for maybe individuals that come in, for, maybe just physical therapy. I mean, maybe they come in 1 or 2 times, and maybe we don't see them for 6 months, but then they re-injure themselves and then they call us back and they know that, we can bring them in and that we're going to give them exceptional care. And so they come back. And so I feel like for the most part, a lot of the people that come in, we're with them for the long haul, for sure.
Sounds to me like you guys have built a lot of trust within your clients to be able to sit there and I'm there doing yoga and I say, hey, I want to get into maybe some martial arts or something like that. And as the people that you recommend for Tai Chi, I know you do Tai Chi there as well, but to be able to say, well, I really like Jen and Christina. I mean, they've done well by me all this time. Why would they go against that? And it's a matter of trust and a matter of relationships that you guys have really built, I think.
Yeah. And I feel like just people, when they come in and they start with one provider, they develop a relationship and a trust, like you said, and they're open to being guided to whatever it is that they might need, for sure.
Right. Hey, let me sort of shift gears a little bit here. You mentioned that you are part of the business association, which is the South of Forest Drive Business Association. SOFO. Correct. And you are the president of it, aren't you now? Now, were you one of the founders?
No. So, the interesting thing about, anything in life, I would say, is sometimes you just kind of fall into things. So this would be a perfect example.
See, for me, it's a hole, Yeah. And I wrenched my knee, that's how that works for me, but.
Yeah, exactly. So, we were basically just opened into 2014, and I was listening to WRNR driving to work one day, and I heard a commercial for SOFO, and I was like, "Oh, Christina, there's a business association for Forest Drive. We should be a part of that." And she's like, "Absolutely." So I signed us up, started attending some meetings. Over a course of about, I would say, maybe a year and a half, 2 years, all the folks that had started SOFO kind of left for some reason, whether they moved away or their business closed or somebody changed jobs. So all the founding members kind of stepped away. And then it was like, okay, well, now who's going to run it? And John, how it is, everybody takes 2 steps back.
Right.
And there I was. And, the suggestion was, well, we can just shelve it for a while. But I felt like it had great legs. It was doing great things for the community. And if you step back and you shelve it, then it just dies. So I signed up to run it for 6 months, and that's been about 5 years now.
Then let me compliment you on what I've seen. With that, I mean, it's becoming a very well-known business. You've got a beautiful new sign on the corner in front of the BB&T Bank.
Oh, yeah. Super excited about that.
You've done the cleanup right there in the little triangle, right there at Bay Ridge, Hillsmere, Hillsmere, and Forest. You've got the fence out by Annapolis Middle School that you've done. And that's just the public beautification that you see there. But the businesses that are in there seem to be really committed. I mean, you've got Evolve that's in there, medical clinics. You've got Soul. You've got yourself. You've got, I know, KB True Value. You've got Bay Bridge Wine and Spirits. You've got Grumps, even though they're not on Forest Drive. But I know you've got Sam's on the waterfront.
Yep, and Caliente Grill and Main and Market and Gateway Florist. And yes, we have a ton of businesses. And everyone that is a part of SOFO loves the community. So important to give back and to do the right thing by their neighbors. So that's been the beauty of being part of SOFO. It's really a grassroots organization, and everyone gives, their all for their neighbor. And that's the reason why I'm still doing it, for sure.
Well, you ought to take pride in what you have done with SOFO, but certainly with One Physical Therapy, Fitness, and Wellness, both of you guys. The website you guys have is One, spelled out PTFW. And if you listen to the name One Physical Therapy, Fitness, and Wellness, that makes perfect sense.com. And again, 7 years, that's a long time. And
yeah. Christina, how are we still friends, Christina?
So it's okay. I'm glad that you brought that back up. Okay, so it's communication, right? When you say that, Jen, it's us communicating, and sometimes her and I get super busy, and we may not communicate as well, but it's all about communicating and talking to one another. Yes, definitely. That's what I would think. That's what I say.
And definitely mutual respect. So we had, we worked together for 10 years before we ever opened our doors here. And with that, we were able to see each other's work ethic, our morality, and how we care about our people. So I think that when you have those things and we're on the same page, then you're going to have a successful work relationship for sure.
Well, I do think that work ethic, morality, and caring is a perfect recipe for any type of business, especially one like you guys have done. And I think you've done an outstanding job.
Thanks, John.
Thank you.
Well, One Physical Therapy, Fitness and Wellness is located at 914 Bay Ridge Road, and that's across the street from Caliente Grill, upstairs from Main and Market, or the Capitol Barbershop, or Gateway Florist. And they got a wealth of things. They've got classes, they've got telehealth. And, once we get out of this COVID and everybody starts to get vaccinated, we're going to be able to get back in person again, as well as telehealth.
And in the meantime, we want everybody, there's no reason why people can't continue to exercise safely. So from the comfort of your living room, you can absolutely sign up for a live stream class. And it's literally like having a provider in your living room. So there's no reason why you can't take advantage of that, no matter what or when or where you are.
Now, as professionals, if I do this in my living room, are you like judging my housekeeping skills?
No.
This is a no judgment practice here.
John, we're totally judging. No, just kidding.
Well, guys, this has been a lot of fun. Again, we're speaking with Jennifer Balducci and Christina Thomas from One Physical Therapy, Fitness and Wellness, 914 Bay Ridge Road, Suite 212, I think it is, up on the second floor. And the website is one spelled out, ptfw.com. I encourage anybody that needs some wellness, that wants to talk about wellness, that is into wellness, definitely give them a call, give them a look. You've got they're running the SOFO down here, south of Forest Drive Business Association, doing an outstanding job, and it's showing that they're doing it for the business as well. And congratulations on 7 years. Here's to another 7 and 7 and 7 after that.
Yes, thank you.
Thank you so much, Don. We really appreciate your time, and thanks to everyone who might be tuning in.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.